Hello, this is Leah Burke from Pulp Dent Corporation. I'm here with Dr. John Herzog at his practice in Danvers, Mass. And Dr. Herzog has used some of the ACTIVA products, and I'm going to ask him a few questions about our products today. So Dr. Herzog, I know that you've used the ACTIVA Restorative and the Base Liner, and I'm curious to hear what you thought of the products.
I really enjoy using them. They're incredibly easy to use. It's actually become my product of choice for direct restorations. I used to use Filtek Supreme, but now ACTIVA has become my #1 restorative material. My rep actually told it, kind of a turning point for me was when my rep came to me and said, you know, the mistake you're making is that you're thinking of this as a flowable. And that's the way I approached it, was as a flowable material, because it it flows, it's easy to place, and because of the consistency, thought it was a flowable composite. And he said, you know what, you got to start thinking of this as a restorative material, not a flowable. That's why they don't call it a flowable composite. And then I learned that it wears as well as any condensable composite out there, so I started using it more in that fashion, and I've been really, really happy with the results. Comes out great. It has a chameleon type property where it matches shade well. The ease of use, as I've said to my assistant, I feel like I'm kind of cheating because it's so easy to use. So yeah, I'm very happy with it.
Great. And have you tried the cement yet? We have a new ACTIVA cement.
I do use the ACTIVA cement. I use it, I'm just converting to it, so I do use it. I've used it a few times. Like the ACTIVA, incredibly easy to use, real easy to clean up, spot cure, peel it off. Very happy, no sensitivity. I like the fact that I don't have to etch the tooth when I'm using it, so that's a plus to me. Some of the other cements that I use, you need to etch the tooth, that are a fully prepared tooth, and I'm etching with phosphoric acid. So I don't etch when I'm using the ACTIVA cement, and been very happy. No complaints whatsoever.
Are there particular situations when you use ACTIVA?
Initially, when I started using ACTIVA, I used it. There's an older product from Denmark called Jerry Store. I'm an amalgam-free practice, so I don't place, or mercury-free practice, so I don't place amalgams. So there are times when composite's really tough to use, when you subgingival, tough access areas that in the old days I would use amalgam for. And Jerry Store kind of filled that niche for me, where it was really easy to place. You could squirt it in, cure it, it bonded well, released fluoride, and but I didn't like the aesthetics of it that well. And so when ACTIVA came out, I started using that as kind of for my tough situations. And it worked well and looked great. And so that's where I initially started using it, was in the really tough spots. Like I said before, now it's really become my go-to for restorations. We do a lot of CEREC, so my larger restorations are pretty much indirect, milled restorations. But for any class 2, class 5, it's awesome. It's great for small restorations. It might be hard to pack a composite in. You just squirt it in and it fills it and cures it. I was concerned initially with class 2s that it would fill down in the box, because in the proximal box, because I would, in my old technique, use flowable composite and regular composite, pack it so it would spread and fill in. So the first few restorations that I did with ACTIVA in those areas, I was doing on staff who needed them, or family, and then taking x-rays, and it filled in incredibly well. So I don't have that concern anymore. Another place where I think it works really, really well is sometimes in the interior I'm packing, or a tough area I might be packing a mylar strip. And prior to using ACTIVA, I need to use a wedge or something to hold the band up against the tooth. A lot of times that causes bleeding, and can be kind of tough. And now, if I'm holding a mylar strip with my finger, I don't really need to wedge it, because I'm going to squirt in the ACTIVA. It doesn't displace the band at all, which was kind of an interesting find for me. I'm like, oh, this is great. I don't have to wedge this. It's not going to push by and have an overhang. I squirt it in, it fills up where it needs to do, and any of the excess just comes right out of the cavity. So it's been great for those interiors. I think a funny thing about it is the more I use the more I've used it, the more uses I found for it. So I'm using it for core buildups now. I'm using it for repairs on fractured porcelain or crowns, and I'm using it for my day-to-day run-of-the-mill restorations. So it's really become my go-to composite.
So you brought up class 2s, and I know that class 2s and bulk filling is a really hot topic right now in the dental community. And there are some dentists who are wary about doing bulk filling and about doing class 2s. Do you have any advice for them?
I mean, I think it's a legitimate concern. I do, when I'm working on a bulk fill, my only concern with the ACTIVA or any composite is if I'm substantially subgingival. So because I'm not going to get a second shot to cure that. So if I'm a decent amount subgingival, I will fill the base of the box and we'll cure that first, and then we'll bulk fill back from there. As long as I'm super gingival, I'm not really too worried because I get to cure it from the occlusal, and then we use sectional matrices. So before I remove the sectional matrix, we'll be able to cure from the buccal, the lingual, and we hit it a few times. Plus, it's a dual cure.
Right.
So, but even that being said, the dual cure, I'm not sure how long it takes for it to fully cure. So if I have something deep subgingival, that's the only time I have an issue with it, is when I'll cure the base of that proximal box until I feel like I'm about tissue level, and then I can just fill up the whole thing, and then we just cure the heck out of it. Pull out the sectional matrix, had no problems. Anything super gingival, I'm not worried about. And if I have to put a full band on, I guess that's a concern because I can't get access from the buccal and the lingual to cure. But as long as I'm using the sectional matrix and I've cured the subgingival portion, then I don't have any worries after that.
And you mentioned that you've had staff members and who you've used ACTIVA on. So what do they think, and what are the other clinicians and hygienists and assistants in the practice think about ACTIVA?
I think that, well, my associate has been using it as well. She likes it. She uses it. She finds great uses for it. One of her comments was when she needs to, and she does a lot of the children in the practice. So when she has a patient that's tough access, that she's got to get in and out quick, she finds ACTIVA is much easier to use. So she uses it a lot. It's pretty much her go-to now for restorations as well. My assistant, I know, feels somewhat like I said before, I feel like you're cheating. It's really easy to place. We're not using multiple materials. I'm not using a flowable and a packable, and it's, she just grabs that and we go with it. And so she feels somewhat like it's easier. Definitely feels easier to use. It's really easy to contour and polish. It's somewhat counterintuitive, the fact that it flows and yet wears so well. Doesn't make sense. But that's what the studies show. So I'm going with this. What the studies show, time will tell. But it's counterintuitive that it would be a flowable and wear so well. It's also, it trims very easily. It's much easier for me to trim and polish, to create an embrasure and a contact and a contour. So that doesn't seem to make sense, but it does. And I was also concerned about contacts with my sectional matrices, because I would, in the past with a packable, feel like that's what was helping to get my contact. Get perfect contacts every time with the sectional matrix, which was great news to me. I was concerned initially about that, which is why I started with staff. I was like, okay, I'm going to flow this in and cure it. What happens when I pull out the sectional matrix and I have an open contact? Doesn't happen. But actually, I think with my packables, sometimes the contacts were too tight. And these, when I pop off the matrix, nice light contacts. I can't say enough good about it. I really can't. I really enjoy working with it.
That's great to hear. And you mentioned that that one of your colleagues uses it mostly on children. Are you using ACTIVA on primary and permanent teeth?
Absolutely. It's pretty much direct composite. I'm trying to think. I mean, there's not a specific reason why I don't use it, but it's pretty much, like I said, our direct composite now is ACTIVA. It works great on kids. It's great for, it's great for seniors. I mean, we have patients from 2-3 years old to 100. So, and plenty of seniors, more and more. It's great to use. And with the fluoride release and the dual cure, I feel very comfortable using it. I said I use it for core buildups now, and I feel like when I flow that down into a core after root canal, so I don't worry about whether it's going to be cured deep down in. It's a dual cure, I'm going to be all set. So it's been a really easy product to use, easy to convert to. And I think